Good day, dear viewers, and welcome to another enlightening episode of Face It. On Face It, we talk about different issues bordering on the society and even our individual lives. And today we are delving into a topic that is both crucial and often overlooked. Now, that is the struggles of children with special needs in Nigeria. In Nigeria, the journey for special needs children and their families is fraught with obstacles, from limited access to specialized education and resources to societal stigma and misunderstanding. These families face a tough road, yet there is hope and progress thanks to the dedication of passionate educators and advocates who work tirelessly to support these children. So to help us understand the intricacies of this issue and to shed light on the path forward, we have a distinguished guest with us today. She's an esteemed educationist and a recognized expert in the field of special needs education. With years of hands-on experience and profound insight, she's been a beacon of hope for many families navigating these challenges. And I'm most especially eager to hear about her experiences, her insights, and her suggestions on how we can create a more inclusive and supportive environment for children with special needs in Nigeria. Please join me in welcoming Mrs. Maureen Ola-Williams. Good day to you, Ma. Good to have you in the studio.
Thanks for having me. Good day.
How are you doing?
Very well, thank you.
So to this topic that we're talking about, special needs education, for myself personally, I am very, it's one topic that I am also very interested in, and it's quite unfortunate and sad that in this part of the world, in Nigeria, we most of the time don't talk about it. What exactly is the cause of it? What can we do? Tell us about your experience working with children with special needs.
Okay, so thanks for having me. My name is Mrs. Maureen Ola-Williams. I am a passionate educator. I have a strong foundation in special needs education. I've had the privilege of empowering teachers and parents in the field of special education. I've done trainings for them, empowerment and all that. Also had the privilege to be involved in some esteemed organizations like International Dyslexia Organization, the National Organization for Special Education, the International Organization for Special Teachers and all that, through which I have been able to gain more knowledge and more insights on how to deal with kids with special needs. So I hold a first degree in biochemistry. I'm actually a biochemist.
Oh, really?
Yes.
Wow.
I'm a biochemist, and because I have the passion for teaching, I love children. So I went further to have my master's in science education, and currently I'm running my PhD in educational planning and management.
Okay.
And then to complement my academic qualifications, I've had some international certification in special needs education, and then belong to some organizations, which has really helped me a lot in learning more on how to empower kids with special needs.
So why the love for special needs kids? I mean, the other time you talked about passion. You studied biochemistry and later on decided to delve into, being more involved with, kids with special needs. Why this especially? I mean, do you have like a personal relationship with someone? What, spurred you to say, oh, I'm interested in this?
Yeah, thanks for that question. First of all, being a biochemist, it's more like having a knowledge. I needed that knowledge, although that wasn't the reason why I studied biochemistry. I had other reason. But after I graduated as a biochemist, I just felt a need to have more connection with children. Number one, I needed to be closer to my kids. I want to be a mom who is around the kids and close to my husband as well. So that's why I chose the educational line. But what pushed me further into special education? Because I realized there is need to have people who have more passion, who have love for these children, due to the fact that they have been somehow neglected, The empowerment is not there. The support system is not there. People don't want to talk about them. People don't want to get involved with them. The stigmatization is taking over everything. So with that, I began to have this passion. I felt there is need for it. Aside that, I told you I'm an educator.
Yeah.
So I'm a Montessori trained teacher. So I have a broad knowledge, a good foundation in Montessori. Now, if you're going back to the foundation of Montessori system of education, somehow we started with kids with special need. Dr. Maria Montessori, she was able to bring up her system, the Montessori system of education, starting with kids with special needs. It came up, she started with these kids. She realized that these kids were being put in a room, in a classroom that were not stimulated. The environment was not conducive. The environment was not stimulated. The care was a no. There was zero care for them. Now, it starts with environment, okay? So with that, she came up with strategies, policies, trying to fit the environment. And after that, she came up with cares. How do I care with these kids with special needs? So it first started with Dr. Maria Montessori, and that's why I'm so passionate about Montessori system of education. Okay. Then after that, she came up with some policy, she came up with some curriculum, which today is what makes up the Montessori system of education. So with that, because I have passion already for Montessori, so with that passion, I decided to dive in further to special education, to learn about special education. How do I help these kids with special education?
So when you say special education needs, because these words, people say it, if not most times, but some people would say, oh, I've heard special needs, but in a layman term, can you help us to break it down? What does it really mean?
Yeah, thank you. Now, special educational needs. Now, let me remove the word education and let's dive into special needs. Okay, you might want to ask me, what are special needs? Now, special needs are those requirements. The word need, I'll push it to requirements, are those requirements, those needs that are needed by people who have learning difficulties, who have disabilities, who have, and then what are these learning difficulties? It's a bit broad, but I'll try to break it down. Now, under learning difficulties, you have things like dyslexia, you have dysgraphia, you have dyscalculia, you have auditory processing disorder, and a lot more. Now, let me break dyslexia for you. What's dyslexia? Now, you have kids that have some learning difficulties that even teachers or even their parents are not aware of. Now, they more like stigmatize the child. My child doesn't know how to read. My child is not learning spelling, not knowing that the child has a special need, which is called a learning difficulty. Now, dyslexia is when a child has issue with letters. Now, you're seeing the normal letter, but the child who has dyslexia is seeing dancing letters. Now, the letters are dancing. When a child sees a B, it looks like a P. Now, when a child sees a P, it looks like a B. So he has issues with phonology, he has issues with spellings, he has issues with reading. So that's what you call dyslexia. It's a learning disability. Now, there's another one, a learning difficulty. Another one we call dysgraphia. Now, when you hear dysgraphia, what should come to your mind? What comes to your mind is handwriting. Now, some kids struggle with their writing. They have a very poor writing. Now, it's a learning difficulty. Because if you can't prove down very well what you have in mind or what you can see on the board is an issue. A child who is writing and is unable to read is an issue. Now, another one is dyscalculia. That's a learning difficulty that has to do with mathematics. Now, these kids have issue with numbers. Okay, they have issues with number, they don't understand numbers, so they need help and intervention to help them with number. Others are more like auditory processing disorders and all that. Now, let me move to another one, the disabilities, the one that is commonly known. I'll just pick one. I'll pick autism, for instance. Okay. Now, autism, the full name is autism spectrum disorder. Let me pick the word spectrum. Now, what is spectrum? Spectrum is embodied in a wide range of challenges. Spectrum is embodied in a wide range of challenge. Now, autism spectrum disorder is a developmental disorder that comes with a lot of challenges and disabilities. It comes with emotional disability, it comes with social issues, it comes with sensory issues, it comes with ADHD, which is called attention deficit hyperactivity disorder. Autism comes with a lot of disorder. So it's more like having one a lot in one. So that's autism spectrum disorder. That's where you get the word spectrum. And we know it as a developmental disorder because you get to find out about this as early as 2 years if you're very observant. Yeah, it comes with
I mean, talking about observation, because I mean, we've been talking about this now, and you mentioned, dyslexia, having kids who probably when they see writing, they see dancing alphabet. I've also had the opportunity to tutor in schools, in secondary school, primary school. I was teaching French in some schools, and I observed that a little girl whenever she's supposed to write D, she'll write B. Whenever she's supposed to write D, she'll write B. And then, I keep on correcting her, but she's not getting the correction. Then I observe patiently that it's a problem. But sometimes when parents hear that, the next thing they want to do is punish or beat her. When you beat her, she will get it. I mean, she's just being spoiled. That's what they say. So bringing it to Nigeria, I mean, the society we find ourselves, why do you think it's not something that people are talking about? Is it that they don't know? Is it that there is no awareness? Because I mean, this dyslexia, if you're discussing with another person, some people don't really see it as a problem. They think that, it's just stage, or she'll be fine. I mean, she needs iron hands. That is what most people will say, that most times that acceptance is not there, that it's a problem. So what do you think is behind all this?
If I'm a parent and I have a child that's having issue with letters, has issue with sounds and spellings and all that, some parents might tell me it's okay, the child is being lazy, or some teachers might tell me the child is being lazy, he doesn't want to learn, he doesn't want to write. But no. Now, when there is awareness and when there are trainings to enlighten people on these learning difficulties, then you will be able to identify or note that the child is having this issue. Now, when you identify this issue, you then be able to come up with strategies with help and with support to help the child meet some milestones or achieve some potentials in life. So that's it. I think awareness is the key thing, because some parents don't even know what these learning difficulties are. And aside the parent, the teachers who are teaching the children, some teachers have no clue. So I think the first thing is awareness, and there's need for training. Intensive training for teachers and parents and guidance.
Okay, so in your years of experience, I mean, you've worked with a lot of kids with special needs. What are the most common, special needs children that you come across, and how have you been able to deal with them? What have you learned? And going forward, what do you think that how do you think people can deal with them and manage with their issues?
Yeah. Thanks for that question. Okay, I think I will pick the learning difficulty. I think I'll pick from the learning difficulty, and I think it will be autism spectrum disorder. Now, let me dive into the learning difficulty, because it's one thing that affects a lot of pupils, a lot of students. Teachers don't know how to manage it. Even the parents don't know what it's all about. I think we should look deeply more into learning difficulties, dyslexia and dyscalculia. Dyscalculia has to do with mathematics. Now, some people might have phobia for mathematics. Some don't like mathematics. And then they tell me, it's just a phobia. He's just been lazy. No.
Are you saying that normally every child is supposed to like mathematics, or the moment a child does not show interest in mathematics, then the child has dyscalculia?
No.
Okay.
Well, I won't say that. Some people generally don't do well in mathematics, and that does not mean they have dyscalculia.
Okay.
No, it's at all. But sometimes it takes a professional. That's where a professional should come in. Now, if you're a professional in the field, you'll be able to tell if this child has dyscalculia, has dysgraphia, and all that. So they are professionals who are good with that diagnosis. But what do I do as an educator or as a teacher? How would you identify that? So when you see some symptoms or some observation, that's where you call you call the attention of a professional for further diagnosis and for further interventions. How do I help this child? There are various strategies. There are ways they learn. There are ways you support them. You don't treat them like any other child. So that's
okay. So are there also other learning difficulties? For example, I mean, we know of Down syndrome, autism, ADHD, just as you
ADHD.
mentioned. Do you have any experience with some of these things? What are the challenges that they face?
Okay, so let me pick autism,
Okay.
autism spectrum disorder, because number one, autism is most common among pupils. I've got to work with kids and adults who are autistic. You know, over the years I've been working with them, so I understand a bit about autism. Number one, it takes patience. You must have compassion. You must be loving, and you must have love for the children. Now, it takes a patient person to observe a child, because before you know a child who is autistic, you must be observant. Now, if you're not patient, you will not be able to observe. Now, how do you observe a child to know a child is autistic? Now, a child at play is a true child. That's a quote from Maria Montessori. So you observe them at play. The moment you realize that a child is not meeting a developmental milestone at 2, if a child is expected to talk at 3, is expected to do this at 4, and is not reaching those milestones, it calls for concern. Okay, so from there, you pick it up. They come up with some developmental issues. They have speech issues. Some of them don't talk on time. They have sensory issues. They have social issues. They have issues interacting. They have speech delay. They have auditory issues. They don't talk on time. They don't respond. And then in public, they don't mix up. They have social issues. So when you see this, especially what they call ADHD, attention deficit hyperactivity disorder, that's another, is embodied in autism. And I told you it comes with lots of challenges. So ADHD is another factor. What's ADHD? It's when a child becomes hyperactive. It doesn't give you eye contact. Okay, you're talking to the child, and the next second the child's attention is off. He's involved in everything. He doesn't get tired. The energy is there. So that's ADHD, and that's one factor you get to see in autistic children. So when you experience or you notice one or few of this symptom, as an educationist, it calls for concern. And that's where you call in a professional. Remember, you must call in a professional to be able to do a good diagnosis. So you don't just decide, even as an educationist, no matter your years of experience, you don't just decide and conclude this child is autistic. No. It takes a professional to come in and say, okay, this child is autistic, and then come up with strategies and then help interventions.
Okay, good. So let's talk about cultural attitudes. I mean, this is, in this part of the world, this is Nigeria. How do cultural attitudes in Nigeria impact children with, special needs? How do you think that cultural attitudes, sometimes when some people hear things like this, they'll say, oh, it's a spiritual thing. Sometimes, right. Families in this situation would not even bring out their children. Even when they know that they have this problem, they probably put them into hiding. How does cultural attitudes, even in this part of the world, contribute to the problems with special needs kids?
Okay, I think first thing we should do to help, number one, is awareness is the key thing. Now, if I'm a parent and I don't know what autism is, and I have a child who is autistic, tell me, how do I help? And I'm not enlightened and I'm not educated, definitely I will term it as a spiritual problem. So number one, I think, is awareness. Okay. There's needs for enlightenment. Parent needs to know. We need to have opportunities of bringing them together, talking about these issues. Now, what are the signs you have to see in your child that cause for alarm? If there's training, if there's awareness, if everybody knows about this, and then everybody puts hands together and come up with solutions. I think number one thing is awareness and training, because no one will want to accept that the child is autistic if you're not enlightened. No one wants you to label the child as being autistic. So that's why in the educational sector there is need for intensive training. Training for the teachers, training for the parents, training for the guardians, not to label these children, not to stigmatize them, not to label them as being a spiritual issue or maybe a curse from the gods. No, it's not. These children are actually, will I say, I will call them specially negative they are not special in a negative way. Let's see it this way. Okay, each of us are made up of different puzzles. Okay, I'm made up of different puzzles that comes together to make me who I am. You're made up of different puzzles that comes together to make you who you are. Now, kids with special needs also have puzzles. Now, these puzzles all only need special help to help them fit in well. That's just it. It's just a puzzle. What they need is help to fit in well.
But in this part of the world, are we accepting it well, or we're still in denial?
Well, those who are enlightened and learned are accepting it. But those who are not enlightened, you can't accept what you don't know. You can't accept what you're not aware of. That's why I still go back. There is need for awareness. There is need for training to let them know that you don't stigmatize these people. You must love them. You must show compassion. You must have empathy. And if you don't have these qualities, I doubt if you can move forward in this generation.
Okay. Right about now, we'll take a quick break. And when we're back, of course, Face It continues. Stay with us.
So instinctive and so passionate. Every word I move so descriptive like an adjective. I got a vendetta against people who patented being negative when you should be getting after it. I got facts over tracks, this and that. Spitting slow, speaking fast. I could roast, I could gas. Think I'm okay at last, but I don't know if that can erase all the past. And the pettiness, a reflection of the emptiness. Hilarious, you think you're with my time, you're delirious.
Words like visual impairment, Down syndrome, dyslexia, autism, and the rest, what comes to your mind? Special needs problems. Well, these and many are what we're talking about today on Face It. Well, if you've not really been watching, well, I tell you, you are on the right channel. You're still listening to Yo TV right here, and today on Face It, we're talking about the challenges and struggles that come with special needs kids. And of course, we have an educator who is also an expert in this particular field, talking about Mrs. Maureen Ola-Williams. I mean, we've been having a wonderful conversation. Still good to have you in the studio. Now, taking the discussion, to another angle, let's talk about courses. The other time we're talking about how some people, especially in this part of the world, think that, it's a spiritual problem. It's not ordinary. You hear some people say, even in Yoruba, permits me, they'll say, Oju Ayeko, things like that. But from your years of experience, what do you think? Because I was saying it the other time that, cases like this were not really common back in those days. They were there, but the rate at which we have them now is increasing. And I wouldn't want to know, maybe medically there's a cause for it. What leads to someone having a child with Down syndrome or dyslexia? Are there causes for it medically?
Yeah. Well, there is no definitive cause for special needs or learning disabilities or disabilities. There is no known cause. You wouldn't say, okay, this is the cause or that is the cause, but there are some things, or should I call it some risk factors? There are some things that we might feel might be the cause of it. Okay, it boils down to when, number one, the moment a woman is pregnant, and people that are engaged in having alcohol while they are pregnant, it could be a risk cause. It's actually very dangerous. Some women, when they are pregnant, they take lots and lots of alcohol, they take drugs, they smoke and all that.
Some might hide under cravings because they say you crave for weird things.
Exactly. So while there are no known cause or no definitive cause, if I must say, but there are some things that we feel might be the cause, which we advise people to stay off, to stay clear of. Number one, when a woman is pregnant, we don't advise them to smoke, to drink, or to engage in drugs. So because it's quite dangerous and it can be a causative factor. Then another one, I could call it maybe a gene, the mutation in the gene. could be from the gene, probably a mutation in the gene can be a causative factor. And another one might be the blood, maybe inheriting it. You might have granddad, grandmom, maybe the 5th generation back, who has had this disorder. Of course, we might not know. We only know our grandmom and granddad. We might not know a generation, 5th generation down the line, who has had this. So if there is someone in the family, who has had it, there is a probability that a child might come up with that. So number one, alcohol, drinking while pregnant, smoking while pregnant, and then family lineage can be a factor, gene mutation can be a factor, lifestyle can be a factor. So if all these things are looked into and prevented, I think will reduce.
But I mean, this is also on a lighter note. I mean, because in Africa we have some myths about the pregnancy stages. Some people say when you're pregnant and you're already almost due, there are certain times of the day that you're not supposed to walk out and all of that. Do you think all this have any effect?
I would just call it superstitious. I just advise mothers, the moment you notice you're pregnant from a day old, I advise them, stay off alcohol, stay off smoking, stay off drugs, take good care of yourself, and then you have to change your lifestyle, because lifestyle matters. What you eat matters, what you think in matters, where you go matters. Even if you're not smoking, you shouldn't be around people that are smoking. Now, this can be a causative factor. Yeah. Medication, the kind of drugs you take can affect the child, yes. And then even from the family, I can't really say this is the reason or this is the cause.
You just have to be very
There
careful.
is no known cause for autism. There is no known cause for learning difficulties. Nobody wishes to be in that situation. Nobody prays to be in. So people just have it. So all you have to do is to come up with strategies and then accommodations and supports.
Are there possible cures?
Well, I will also say there are no possible cures, but there are therapies. Well, I'll call them therapies. I'll call them interventions, accommodations. And this ranges from, if you're looking at therapies, you look at speech therapy, you look at occupational therapy, you look at under accommodations, you look at behavioral analysis and all that. Then you look at social training skills. You need to train them on how to behave outside, how to carry themselves, how to mix up with others. It's just to come up with support, therapies and strategies. So there is no known cure. All they need is interventions, they need help, they need support to be able to meet up some certain milestone and to achieve some certain level in life.
Okay, now talking about support, I mean, what support system are available for individuals with special education needs?
Okay, there are various support systems, if I may say. There are lots of them. I will start with, it starts from you and I.
Okay.
It starts from you and I. Now, when you notice a child that's autistic, what do you do? It starts from you. How do you react to such children? You must show them love. You must be compassionate. You must have empathy. Now, when that is there, you already started. Then aside that, it starts from everyone around us. Then aside that, what support system do schools have? Do organizations have? Number one, you must have, like those that have ADHD, those that are autistic. Some of them are visual learners. Okay, they are visual learners. They learn by sight. They have some technologies that's really helped them. There are lots of technologies, that helps to aid learning and all that. So assistive technologies can help, support system and then another thing is the environment. You need a supportive environment. Just like Dr. Maria Montessori said, that environment makes up a child. The environment you place a child determines how the child will bloom or how the child will grow. So you need the right environment. Number one is called a stimulating environment, or rather a prepared environment. So when the environment is prepared, it has the right color, it has the right material, it has the right equipment, to make learning faster and easier. It has technologies. You have a smart board, you have things you could use to learn visually, you have some materials like the Montessori materials could help, those pink tower, the broadband stairs, and then some enrichment materials, it could help and all that. So with all this, I think there'll be a way forward.
So with all of this, do you think it's possible that people in this situation live a normal life?
Well, it's our duty to help them, as I said earlier, to help them fit in their puzzle. We can only help to support, assist them to live a normal life. If they are in the right environment, if they have the right people.
The reason I'm asking this is I've seen some cases, well, not in Nigeria, but I've seen some cases abroad where autistic people almost have a normal life. In fact, if you're not very, very attentive, you might not even know that the problem is there. I mean, this person that I'm talking about has a job. I mean, he's a delivery person. He earns money, although you know that the problem is there, but he talks normally. He might not be able to write because his writing is not coordinated, but he almost acts normal and he lives a normal life. So I mean, this is just like a beacon of hope to some other people. So I mean, I don't know what the awareness rate is in Nigeria, but I mean, for people who are also in that situation and they have children like that and they are probably brooding and thinking, oh, can my child ever have a normal life? I mean, what do you think about this? Can they actually have a normal life? If yes, what are the things that parents can start doing to make sure that kids like this have a normal life? And how early?
I would say yes, that kids that are autistic, that have learning disability, they can have a normal life. If they have the right support system, if they have the right love around them, they have everything that will help them to reach some milestone, they can have a normal life. Now, what are those support systems? Number one is acceptance. You must accept as a parent that your child has this. When you accept that, the other thing is training. There should be awareness. You need to be trained on how to manage them. You need to be trained on how to follow them. You must have the right quality. You must be patient, you must be loving and all that. Then that's where inclusivity comes in. That's inclusion. Inclusion is empowering the environment to be sure there is diversity, you know, to accommodate them, help them in the society, irrespective of their background, of their race, of their nature. You know, inclusivity is one thing that we should look at. Now, when they are considered in that environment, they have the right love, they have the rights, everything that they need to bloom, I bet you they will fit in and they will live a normal life. They must have the right support system. They must have the right therapy. They must have the right developmental help. For instance, if a child is autistic and he has speech issue and he doesn't consult with a speech therapist, tell me, how will the child survive? Or possibly, if he needs the help of an occupational therapist and it's not there, he or she might not reach the milestone on time. Or then if he needs social skill training and he doesn't have the right support, it will delay its growth and its development. So he needs the right support system, he needs therapies, he needs social skill training, they need a lot of support. So if all these things are put in place, I bet you they will live a normal life.
All right, now let's talk about the current state of special education needs in Nigeria. What do you think is the current state of special education needs in Nigeria? Where are we?
Well, I will say that Nigeria is really facing a difficult challenge. It's quite challenging in Nigeria if you have a special child, because number one, there are lots of issues and lots of challenges. The state of special need education in Nigeria is not that encouraging. Why? Because number one, they don't have the right resources. That's number one. What do I mean by the right resources? If you have kids that have special need, they need to be placed in the right environment. You need the right material, you need the right equipment to work with, you need technologies.
I mean, do we even have available personnel and facilities to do that in Nigeria?
Well, I think we have. Yes, we do. We have. They're out there. The thing is that, are you really looking out for available people? Because there are lots of them out there. I'm a passionate teacher and I have love for kids, especially kids with special needs. So, oh yes, they are there. They're out there. But are the government looking out for them? Do they really need them? Do they have interest in taking care of kids with special need? Do they have passion for them? Is that their priority? Now, when you make it your priority, you'll find them. They're out there. We have speech therapists. We have occupational therapists. We have psychologists. We have lots of them. But is it their priority? Is there an inclusive education in Nigeria? So when you put things right, I think there will be a way forward.
So even for an average person, how important do you think is inclusivity in mainstream schools for children with special needs? I mean, I remember while growing up in my primary school, we used to have one guy. In fact, as little as we were back then, he was the oldest in our class, but he was autistic. We used to call him in Yoruba, we used to call him Agba, that is the eldest, you know. But that was just what his parents could do. They just, you know, brought him to a normal school because they wanted him to have education. Although I don't know if it worked in a way, because I mean, it wasn't really following. He just knew that he was coming to school and the rest. But I mean, would you advise somebody who probably is not able to afford all of this to take his child to a normal school?
Well, I think there's need for inclusivity in school. Inclusive education is crucial. Why do I say that? Because you can't segregate these children. You don't make them feel worse than they already are. Okay, if a child is autistic and then you're telling the child, no, you can't be with them, you have to be there. What are you telling the child indirectly? You don't belong there. So irrespective of who they are, irrespective of their background, okay, irrespective of their challenges, I think they should feel among. They should be accepted. They should be loved. They should do whatever every child is doing with the right environment, in the right environment, with the right resources. So I think there is need for inclusivity in Nigeria. That will help reduce that stigmatization. Because when you include them, when you mix them up with other kids, they get to learn from those who are normal. Okay, if they don't behave well, if they are not acting well, and they get to see kids who are acting well, they will want to act well. But if you're mixing same kind of children together, for crying out loud, what do you expect to get? A child who has ADHD, and then you're mixing the child who has ADHD with another child who has ADHD, for crying out, what do you expect to get? So there's need for you to bring them together, make them feel loved, make them feel, among. That's what inclusivity is all about. Diversity, fitting them up in the normal education. But in the right environment, there must be the facilities and everything they need to strive.
Sure. Now, still talking about our society, because it plays a very big role in this peculiar situation. What role does early intervention play? And let me put it that way, in the development of children with special needs. I mean, for example, some people wait till the children are maybe 10 years old, 16, before they start seeking for help. So what does the role of early intervention play in this?
Yeah, it plays a crucial role. Now, autism spectrum disorder, that's why it's called a developmental disorder. It starts as early as 2 years. So if it starts at 2 years, do you have to wait till 10 years? That's why there's need for early intervention. Now, at that 2 years, you might start spotting some signs. There are some early signs, early warning signs. You see that the child has issues with speech, has issues mixing up in public, has issues with attention, is not giving you eye contact in a second, is off, that's ADHD and all that. So if you start noticing all this, and then with the help of a professional, you might not be able to cure it because there's no definite cure, as I said, or you can be able to manage them and help them live a normal life. With the right strategy, with the right support system, they can live a normal life. So if you start noticing all this and then call the help of therapists, the speech therapists, occupational therapists, professional in the field, and then they help you with some interventions. And then there are some things that could help as well, like drugs could help, some medications could help. Yeah, for kids who have ADHD and anxiety issues, that's why you need the help of a professional. Now, they can administer drugs that could help calm them down and all that. Okay, anxiety issues, ADHD, they have drugs. Their lifestyle too can be changed. So if you notice this on time, you end up reducing their sugar intake. A child who has ADHD, why pump the child with so much candies, so much sugar, is already hyperactive. So their lifestyle must change. They must have a right diet, a balanced diet. They don't get to eat junks. Why feed the child with junk when you can give the child a healthy food? So there's need for a change in lifestyle. There's need for a good balanced diet. There's need for exercises. Some parents don't pay key attention to exercise. Sometimes they feel exercise is just meant for the old,
or just for fat people.
Yeah, there's need for exercise. They need to exercise daily. Why do they need exercise? They need exercise for their gross motor skill and their fine motor skill. Now, the fine motor skills are the are the little bones of the fingers, while the gross motor is the bones that, the total movement. So there is need for exercise to exercise the fine motor skill, the gross motor skill, and then sensory exercises. What are sensory exercises? Now, exactly, it has to do with the brain. I will take you back a little bit to Montessori system of education. You know, under Montessori, we have what we call the sensorial education. Under sensorial education, it's talking about the senses. You have 9 senses. That's why I am so in love with Maria Montessori. Now, these senses, if they are stimulated at the right time, in the right environment, I bet you could tackle these issues on time. Now, you have some material that stimulates the brain. We have some that stimulate the hearing, like the tactile sense. We have what we call the touch board. It helps in stimulating the tactile sense. We have what we call the pink tower. It helps in stimulating the visual sense. We have what we call the color box 1, 2, and 3. That's the primary colors, the tertiary colors, the secondary colors. Now, these help in stimulating the chromatic senses. Okay, senses of differentiating in different colors, seeing different colors, and having that ability to say, okay, this is color red, this is color. And then you have another one. It's called the baric sense. Baric sense is a sense of weight. The sense of weight. Okay, you lift something and you say, okay, this is light, this is heavy, and all that. Now, so if these things are identified on time, and use the right strategies to stimulate their senses, you get some therapies to work on them, you give them the right food, exercise, I bet you they will live a normal life.
Wow.
They will live a normal life.
I'm so glad to hear that. I mean, we can go on and on and on to really, talk about this issue, but maybe we'll have a part 2 one of these days. But to bring it to an end, let's talk about the parents, because, I mean, it's not easy being a parent to, kids with special needs, and sometimes we find out that, the family is strained, either one of the parties or the two of them. I mean, I've had stories of fathers neglecting mothers to take care of the children because, it turned out to be that way. Now, as a parent, and with the experience you have, what advice or what are your words to a parent in that situation? What would you tell them?
Okay, well, first and foremost, what I will say is, number 1, acceptance is key. When you have a child that's autistic, I think there is need for acceptance. When there is acceptance, then you will know what to do next. Acceptance, observation. You must have love, you must have patience. They already have it, they have it. So you just accept it and then come up with strategies. What is the way forward? Because when you accept early, the earlier you accept and see the need for it, the early intervention helps and goes a long way. So when there is acceptance and you show them love, you're patient with them, irrespective of the finances you're putting, because I tell you, it sucks a lot of money. Because you will need the help of a therapist, you have to pay them. You need the help of some educationists that you have to pay also. But if you have interest in it, you accept it, you have interest in it, you go for trainings. There are some things you can do at home that you might not even need their help. Well, you will need their help, but at least to an extent, you should be able to assist your child to live a normal life. So when you go for trainings like this, they teach you how to train them in behaving well outside, how to feed your child, giving your child the right diet. They train you things like the sensory trainings, how to do some exercises, like those that have speech delay. The speech therapist might advise you, okay, this is what you do. Some they tell them to blow balloons, some they have to do exercises of their gum and jaws and all that. So if you are involved in it, you have passion for it, you're patient with it, and with prayers and hard work, I bet you they can live a normal life. You just have no choice but to love them, accept them, love them for who they are, and then help them live a normal life.
Yeah, thank you so much for that, word of advice. And finally, taking the show to an end, how do you foresee the future of Nigeria, the future of special needs education in Nigeria?
Well, I pray for a better Nigeria. I pray for a Nigeria that will realize the need for inclusivity in the mainstream school. I pray for a Nigeria that will realize the need for awareness. I pray for a Nigeria that will have the passion, have the love, okay, for those kids with special, and then to reduce stigmatization. To remember that in educational sector there is need for there is need for resources, there is need for the right environment, there is need for training, there is need for empowerment. Now you can't give what you don't have. Okay, you can't ask a teacher to take care of a special child and the teacher is not empowered. You can't tell a school to take care of special kids and they're not empowered. So I pray, I wish, I would say I wish for a Nigeria that will see it as a priority. Because if you don't see it as a priority, I bet you there is nothing you can do about it. So I'm hoping that the Nigeria of tomorrow, we have passion, we have interest in special educational needs. And then look out for teachers, look out for educationists who have passion and who can help them, because they are out there. I bet you they are out there and they are really ready and willing to work.
Thank you so much. It's been a privilege having you. Maybe one of these days I'd like to have a part 2 of this discussion and check out some other angles to it. You've been listening to Face It. My name is Oluwase Idaudu and I've been privileged to host Mrs. Maureen Ola-Williams on the show today. We've been talking about special needs kids, and we've been talking about special needs education, most especially in Nigeria. And she's an educationist and an expert in that field, and it's been an awesome conversation. Of course, if you have any question or you also have any comments or you want to volunteer, feel free to drop your comments in the comment section, and definitely we'll get back to you. Thank you so much for staying with us on Face It today. Of course, we'll be back next week, same time, same station. Till then, enjoy the rest of the day. Bye for now.